Scratchy, burning eyes, redness, sensitivity to light. These are all symptoms of dry eye disease, which occurs when the tears produced by the eyes do not keep the eyes sufficiently wet. Dry eye is a common eye disease with symptoms that affects approximately 35.5 million Americans. Today we meet with Dr. Priya Mathews, who will talk to us about dry eye symptoms and how it affects millions of adults.
Nice to meet you. Thank you so much for taking the time and joining us here today.
Thank you for having me.
So just to get started, can you tell us first what is eye dry disease and what are some of the common symptoms for those that might not even know they have it?
Yes, I'm really excited to team up with Abby today to talk a little bit about dry eye symptoms, what it is, and what we can do to find some temporary relief. So it's a chronic condition that's caused by either not enough tears on the surface of the eye or your tears may be evaporating very quickly, all resulting in a dry surface. And symptoms really vary depending on the patient. It can be burning, irritation, discomfort, even light sensitivity, or just blurred vision. You may not even feel anything. But all of this is caused from dry eye disease.
So will it go away? Will it last a while?
It's a chronic condition, so it usually does last a while, but you can find ways to help control your symptoms and keep your eye the healthiest that it can be. But my first line choice for any patients experiencing dry eye treatments is going to be the over-the-counter drops. So I usually direct my patients to the Refresh brand because they have a portfolio of drops, gels, ointments, many options so that patients of differing severity will find something that works for them. They have two new products actually available. So they're called Refresh Relieva PF, which stands for Preservative Free Extra, and Refresh Tears PF. And both of these come in a multi-dose bottle that's very easy to use and have incorporate the hydrocell technology. And that allows for rehydration and maintains the cell volume on the surface of the eye. So these are two great options.
And would you say that at this time of the year, dry eyes are more common, or are there specific times throughout the year?
It can happen any time of the year. So environment does matter. When it's windy, dusty, smoke, those are all triggers. Also, lifestyle matters. So if there's certain times of the year where someone is traveling a lot on airplanes, or there's a certain outdoor sport they do a certain time of the year, that's all triggers for dry eye disease. And then for our patients who spend a lot of time on screens, that's certainly a risk factor for dry eye disease. So we tell them it's important to take breaks away from the screens to really optimize your eye health.
How can people find relief from the dry eye symptoms?
My first line choice is going to be using an artificial tear that's available over the counter. Important to get regular eye examinations.
There's obviously a lot of different products for, dry eyes and even eye drops in general. Why is the Refresh your recommendation?
I like Refresh because as a brand, they just have so many different options and many of them are preservative free. As a cornea specialist, I just always prefer less preservatives is going to be safer and more gentle for the patient long term.
For our viewers to find out more information about what better suits them for the dry symptoms, where can they go for more information?
Patients can always go online to refresheyedrops.com where they can find more information about all of these different types of products available. But you can always talk to your eye doctor too.
Thank you, Dr. Priya, for joining us today.
Thank you so much for having me.